TMS cause seizures?
TMS does not cause seizures, right? There is a very, very, very low risk.
Is TMS safe while taking antidepressants?
It's an important question.
It
and
is.
What to do with people as individuals. And I think all clinicians are a little different with this.
In today's video, we have a very special guest with us, and I'm super excited about this. This woman is so accomplished, it's not even funny. Double board certified psychiatry and addiction medicine. Been in private practice for 25 years. Brought South Bay TMS clinic to South Bay, LA. She did that in 2009, specializing in psychotherapy, psychoanalysis, and pharmacological treatment in couples, individuals, and for families. Certified with every manufacturer, MagVenture, NeuroStar, BrainsWay. She's a true pioneer in TMS, been doing it for so long. We're super proud and super honored to have her on the channel and to talk TMS with us and with you guys. Dr. Martha Koo, super excited to have you. Welcome to the show. Can you do me a favor real fast and just tell us a little bit more about yourself?
Absolutely, Kyle. And I first want to say it's truly an honor, really, to be here. And I'm very excited to talk to you, particularly because you're so knowledgeable about TMS and you have personal experience as well as professional. And I think it's unusual, right, that I get to carry on a dialogue with someone with that much experience. So thank you for inviting me for this dialogue. So I'm Martha Koo. I'm in Manhattan Beach, California. I am a psychiatrist. I'm board certified in adult psychiatry and addiction medicine, and I'm a psychoanalyst, and I'm also certified in psychedelic assisted therapy. And I obviously offer TMS. I've been offering TMS since 2009. I am currently my day job is Chief Medical Officer of Your Behavioral Health, which is a company that includes both Neuro Wellness Spa, and we offer TMS and medication management at 9 insurance-based facilities across Southern California, from Westlake down to Long Beach, and also Clear Behavioral Health, which is full continuum of care from detox, res, PHP, IOP for dual diagnosis and mental health.
So in that one, when I saw that one, Doc, it was super huge to me. I do have background in addiction medicine. I own a treatment center in Temecula, and I really wanted to talk to you about that once we get through some of these questions. But
Absolutely.
addiction medicine and TMS, it makes so much sense to me, and the pushback that I got personally was insane. So I do want to touch base. I want to circle back on some of those, okay?
Absolutely. No, I think there's going to be a lot of TMS, I think, applied to addictive, substance use disorders in the future. I don't know your philosophy. I mean, I think that addiction really or substance use disorder is really more of a symptom of a larger problem usually. And
100%.
so, yeah, so I think there's a lot of utility, but there's more research going into specifically TMS as a technology. We treat, when we have people that are in a good recovery, working a solid program and hit the 90 days. And so insurance is always fine with coverage.
Yeah.
We treat a lot of them, and the way they pop with their cognition and the way they even realize, oh my gosh, there's more depression or anxiety than I realize. It's really a blessing to see. And I think a huge additive component in people like looking to stay and maintain sobriety with like true recovery.
I'm gonna give you this one off the bat. I'm 19 months sober because of TMS.
Wow, I didn't know that.
Yeah. Mhm. Thank
Congratulations
you.
to
Thank
you.
you. Yeah,
Yeah.
I've battled with addiction my whole life. My
Okay.
whole life, as well as anxiety, depression, and
Yeah.
everything that goes along with it.
Yeah.
And no, TMS saved my life.
Yeah. Well,
So
you're probably a good example of, right, until we can really adequately, in a full remission way, treat underlying depression or anxiety, or I don't know your personal circumstance, like it's very hard to expect somebody, right, to not use the coping skills that they have, right?
right.
And it's really the whole, right? I'm a very like it's biological, psychological, social, and spiritual. And unless we're
Mm.
hitting all for benchmarks, really, we're not serving people, to our full capacity and for what they need.
Tell me, what excites you the most about TMS?
Oh, goodness. What doesn't excite me about TMS? I love its efficacy. I love its tolerability. I love the durability that we get with TMS. I love that we're getting more and more reasonable insurance coverage. And I think what I'm most excited about is, what the future holds for TMS. I think the more we understand about neuroscience, the more we understand about brain networks and connectivity between networks and circuits, I think we're just going to see tremendous applications of TMS for, a lot of more clinical indications. And it's so exciting. I tell people, I think TMS is clearly the best thing I will see in my psychiatric career.
Yes, yes. So, and actually that does bring up a different question. All right, guys, I hope you're really enjoying this content so far. If you're new here, do me a favor, hit that subscribe button. It really helps the YouTube algorithm and helps us take TMS to the world. Now let's get back to the show. Where do you see TMS in 5 to 10 years?
Ah, that's a great question. If I had my dream, TMS would make it to a first-line treatment.
Yes.
I have treated, I was doing TMS before it was insurance, and people were paying cash because that's what they needed to do. And I treated a lot of people who had never been on antidepressant medication. They didn't want to be on medication. And I will say there feels to me still something different about an antidepressant naive brain that gets TMS. The outcomes that I got seem superior. The durability of the outcomes, incredible. And I do think that there's something there. I always tell, like, if I had my also ideal research study, it would be literally new people coming in, first diagnosis of depression, right?
Yes.
One arm gets treatment as usual, which is going to be at least be a medication. Another arm gets right to TMS. I think we would see a completely different trajectory. Right. We know already in the literature that the earlier we treat depression, and the earlier we get somebody into remission, the better prognosis they have in terms of future episodes and getting out of the incident episode. And so I just think there's something there. So that was a long-winded way of saying I would love in 5 years to see TMS as a first-line treatment.
Okay.
I would love it to be covered for extended clinical indications, including bipolar depression, including just generalized anxiety disorder, including autism, people with neurodivergence, so people on the spectrum, addiction,
Okay.
obviously,
Okay.
SD, TBI, right? And to venture into some of the neurological, post-stroke rehab. I think some of those indications also definitely cognitive decline, right? The dementias. We have a silver tsunami of aging people we're going to have a lot more, dementias, and we don't have really great treatments for those.
Obviously, I've done TMS, right? But one of the number one questions typed into the search bar is TMS safe?
TMS is very safe. Right? And I understand people worry, right? We have people come, we're doing something to their brain. Of course, it makes them anxious, right? But yeah, the way I look at the safety of TMS is it's safer than most medications, right? In terms of, some people worry about the seizure risk. Actually, seizure risk with TMS is less than with medications, and we know that now. It came out sometimes early in the literature, some of those risks, and we've learned, right, a lot of it has to do with proper placement. And it also has to do with making sure patients are honest, right, about things they're doing maybe outside of TMS in terms of sleep and caffeine and sobriety. Incredibly safe. We've done I didn't start counting our TM sessions until about 2017, and we've done over 100,000 sessions, have never had a seizure. Knock on wood, I guess I should say.
Okay, yeah, knock on it.
Yeah.
Right.
And, probably the worst thing we had was a vasovagal, which is fainting, right? Somebody who just got anxious. We hadn't even applied the coil.
Okay. I get it.
So people do get nervous, right? And the great thing about TMS is they're in a chair, which is very similar to a gurney that can be tipped quickly, and they're surrounded by medical staff. So, like, I always tell people, right, it's not a bad place to have anything,
I typically go with the dentist chair, but I guess gurney works too, right?
Well, maybe, gurney sounds maybe a little bit more negative than a
little harsh.
chair, but
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 okay.
there is a point, right? I tell
Yeah.
my staff, we make sure our staff is more trained with like CPR and fall
Mm,
risk than definitely seizure. Because I tell people,
yeah.
I'm still waiting for somebody to walk in the door and just so happen to have a stroke or a heart attack, like there, that has nothing to do, right,
Yeah.
with treatment.
Yeah. Yeah. My
So I'm
clinics,
like,
I
yeah,
got a hospital right here for
oh,
these
you're
reasons,
lucky.
right? Never had to use them, never had to call anybody, but it's right there just in case, make people feel safe, right?
Yeah.
Which is important. But do me a favor, Doc. Tell me how TMS actually works.
Okay. I love this question. The simple thing that I often say to patients, what I think helps them a lot, is just it's like physical therapy for the brain. That's my go-to. So specifically, right, what we do know about mental health now and mental illness is that the true underlying causes are poor communications or disrupted communications in terms of neurons. Neurons are brain cells, right? And
Hmm.
they function in circuits, and circuits function in networks. So we used to think of like depression, let's pick that one as the example, as a problem with just serotonin, norepinephrine, and dopamine, right? But
Hmm.
we've grown a lot behind that. So we know the specific circuit in the brain that's involved in depression, and we can focally target that with a magnetic coil to get those neurons to fire and fire in a healthy manner and how they should, right? And so to
Right.
me, it's just a when I say physical therapy for the brain, it's like people don't often think of the brain as it's combined of cells. So like if you had your hand in a cast or your arm in a cast for 3 months and you take off the cast and your muscles all wasted, you go to the gym, right? And you start lifting weights and your
Yeah.
muscle starts growing.
Yeah.
And this is a similar thing with neurons, just like the muscle cells. We get them to work, we get them to fire. The more they fire regularly, we do that in a repeated fashion, they get back to firing as they should.
Is TMS permanent?
TMS is not permanent, and that's very important to know. Like I wish it was a cure, but
Right.
we need to remind right patients that depression, anxiety, OCD, we consider these chronic illnesses just like we would consider hypertension or diabetes. And the goal with these illnesses are to get them into full remission. So we can say somebody doesn't have any symptoms, but we would still say, right, they have a history of depression or they carry that genetic propensity.
Hmm.
And so in general, you know, we say it's not permanent. Now that does depend on the patient, right? I think somebody coming in young, one episode of depression, right? I'd still be reluctant to say permanent, but they could go a very, very long time. In general, we say about 70 to 80% of people have a great sustained response for a complete year. And so that's pretty much the expectation. So if you come in, you do a full course of treatment for depression, generalized anxiety disorder, or anxious depression, I should say OCD, that you can go about a year without a recurrence of symptoms. But that's highly variable, right? So we need
Right.
to understand, yeah. We need to understand the person, their other stressors in life, the severity of their illness. If they're doing the other things, right, that keep them healthy, therapy, sleep, hygiene, exercise, purpose and meaning in life.
Thank you for saying that. I mean, it does lead right into my next question: is how long does TMS, the benefits of TMS, last?
Right.
But I also wanted to add on there, what can one do to maintain those benefits after TMS? And
Yeah.
that's something that I think a lot of us miss is, yes, TMS is wonderful and it's going to help us so much. What are we doing after to maintain this lifestyle, maintain these benefits?
Yeah, no, that is a great question, and it's good. I wish more patients were really asking that, but that's the collaborative care, right? Not just like
Yes.
fix me and I'm gonna go off and be all fine.
Yes.
Doesn't work that way. There are a lot of things, and one thing we do at our site is we call it the clinical initiative, and while they're going through TMS, we actually every week address sort of a therapeutic modality, we would say, or a social modality, or an environmental or behavioral thing that they can do to sustain their response, right? So we talk to them about the stuff we said, like we talk to them about one psychoeducation, so understanding what are stressors that they're particularly vulnerable to, right?
Okay.
What are early symptoms of their illness so that they catch it very early and then can check and say like, oh, am I doing all these other things that support me? We talk about exercise, we talk about nutrition, we talk talk about socialization, we talk about community engagement, spirituality, which to me is really purpose and meaning, not necessarily religion. So I think
Mhm.
everybody who's paying attention to what they know are their ways to stay healthy, and they're having a good life balance with that. And then those are mainly the things I would list. And then the last piece is, my rule of thumb is people are not allowed to be discharged from TMS if they're not in individual therapy. Doesn't always happen, but that's my rule of thumb,
Yeah,
right?
okay.
Um,
Okay.
yeah.
There's
So
only so
because
much control we have with that. But yeah, making sure that they are set up is so important. And
yeah,
now if they go, that's obviously on them. But that's the same as eating right and getting your sunlight and all those things as well, right?
absolutely. Yeah. Sunlight's a great one. I didn't include that.
Hmm.
Absolutely. And I think that, people, they need to remember, especially people that have been depressed for a long time. I really talk about sometimes for some people coming out of a depression, there's also a grief process that happens with that, right? There's
Mm,
an identity maybe that has been wrapped up with that. And there's a waking up and realizing, oh, I've missed out on certain things. Maybe I didn't
mm.
pursue the exact career because I couldn't manage, or I was too depressed, or I'm not in a relationship because I was so socially isolating. And so we need the support to help people put the right meanings on that, maintain their self-esteem, and keep them going. Right. I always tell people, to me, it's like a gym. I think the gym is a good analogy. Like, I can't go to the gym for a month and get in shape and then expect it to be that way and never go to the gym.
Right. Well, in the side of that, you can't expect to go to the gym and see results. You're not going to have these big muscles after 3 or 4 sessions.
Very good.
You got to stay the course and stay in there and do the work, right?
You got to stay the course.
Same thing
Absolutely.
with TMS. I see too many people walk out after 2 weeks because I feel so good. I don't need to come back. And
Yes.
then a month later, they're like, "Oh no." Like,
Go.
we tried to
Absolutely.
tell you,
Yep.
right?
Absolutely. No, you're spot on.
um, have you heard of TMS making somebody worse?
I have not had the experience of TMS making anybody's, biological or their symptoms worse in a biological way. I think it can be confusing sometimes. So I'll tell you what I do see. Sometimes we have people that are very, very depressed come in, and when their depression starts getting better, they actually have the energy to mount some anxiety, and they will say, "Ooh, I think my anxiety is getting worse. I think it's just their capacity to be anxious is getting better." Right? Or the other
Okay.
way, right? Does that make sense? Yeah.
Uh-huh.
People that come in highly, highly anxious, and it's covering up like some of their mood symptoms. And as their anxiety starts to resolve, they start feeling, they would say, more depressed, but it's like they're not driven with a motor with all this anxiety. And so they're like, "Ooh, I don't feel as motivated," or I think I'm like not as active. And it's like, well, yeah, that was all cover up, right? That was
Right.
genuine motivation. And so I have never seen it make anybody, I would say, biologically worse, right? I
Okay.
do think we have to help patients put the right meaning on what they're feeling. What they're feeling is
Mm,
very accurate. I always believe what my patients are telling me how they're feeling, but they need to understand. And there is that teeter-totter sometimes with depression and anxiety. I think that happens, and they just need to understand. And when you can explain what's happening and they can relax a little bit, and like you say, then continue with the process,
right.
they can do really well. Sometimes we can tweak the protocol a little bit too, emphasize a little bit more anxiety treatment or depressive treatment.
Thank you for that. Now, what about the ones that come in and say TMS isn't working for me?
Yeah.
Or
Yeah.
TMS they've completed and they say TMS didn't work.
Yeah.
What about that?
Well, it does not work for everybody, right? TMS
Hmm.
does not work for everybody. It's the rarer percentage, but I would say 10 to 20% of the people that we see really don't have a response, or clearly not a remission. Uh, I think we don't know enough. I think that there's one thing, we're limited by the insurance. So in the old days, once again, I
Yeah.
could back when it was cash, right? Like, we didn't end at 30 for acute.
Right.
We ended at 20, and then we did some tapers, and we could bring people back even for 5 session booster. It was great, and then they would do fine for a long time. So I think part of the problem is some people aren't better at 30 because 30 isn't their right dose or treatment course, right?
Mhm.
And we
Every brain
studies
is different.
very much show that, right? We know studies. There's been those studies where they keep treating, and we keep capturing people, right?
Hmm.
So if people are at the end and say it didn't work for me, one, I want to really understand what they're saying, right? Because it just may be that. And I say, hey, listen, can you hold for 3 months? We'll get you in therapy. We'll keep reaching out. We'll have the support for you. And then you can come back because your insurance will cover it again in 3 months. And often then we can capture improvement on those people. Obviously, they can do more if they can afford it, right?
Right.
And can add those on, and it often works for people. Um, and then the only other sort of pool of people sometimes I see, it's well, do they have the right expectation? Sometimes
Uh,
people get confused, right? Some people get confused. Like, I don't know, this is maybe a bad example, but I sometimes tell, like, I'll go into my hairdresser and I'll be like, well, I really want a new face, right? I can't do that for you, right? Like, I want my 30-year-old face.
I like that.
Right. So I think people with TMS, they need to understand, right? This isn't going to necessarily get them a job and get them, it doesn't treat unhappiness. Let's just put it that way. It
Uh,
treats biological depression. And people need to understand the difference between unhappiness and depression. And so I think that sometimes that is what gets mistaken. And they really are better with their depression, and now they're unhappy with their life.
So, are there any common factors around that 20%, right?
Yeah.
Are there any similarities between those patients that we're seeing?
Yeah. No, that's a really good question. I think that sometimes it's severity of illness.
Mhm.
Sometimes, we do have to make sure we have the right diagnosis, right?
Yes.
I think that people do need to make sure they've been compliant with the treatment, right? I don't see that. I mean, we have really good, people showing up and coming on time and completing, but I think that would be a pool of people if they've missed a lot, right? Then
Mhm.
they're not right, honest about substance use disorders, right? That can be,
Right, right.
right? Like they're not really telling you like how much they're drinking or, other stuff.
California, how
Those would
much they're smoking,
smoking. Those
right?
those are the main things. And then like I say, I think uh there those two categories of, I want to say, more like depressive personality, or
Okay.
people that don't have the understanding between unhappy life and depression, and maybe we've treated the
Mm,
depression but they're unhappy. And lastly, like the thing I talked about with grieving, I mean, there can be unconscious resistance, right, really, to getting better, right? Sometimes
yeah.
there's secondary gain, right, to be depressed,
Mm,
or just a lot of anxiety of like, well, gosh, who would I be now if I'm not depressed? Not that they consciously
right.
want to be depressed, right? I don't, it's not a conscious thing, right? It's like like we say in medicine, there's placebo and nocebo effects. Placebo carries a long way, but there's people that no matter what medicine you give them, it's bad for them, right?
Uh-huh.
And so I think you really have to know your patients intimately, and you have to help them put the right meanings. And so I think those are sort of the categories of people that I would see that maybe, we've seen that unfortunately feel like have not gotten a good response.
How effective would you say TMS is for treating depression?
I would say very effective. I mean, I have been so excited with the outcomes. So, I quickly tell people, at least twice as effective as medications. I mean, our site, we track
Ah,
responsive, and yeah, we track response and remission rates. And so we have a 75% response rate and a 54% remission rate, which is really good, right?
yes.
In the typical literature, it might be like 30 to 50 for
Hmm.
remission and maybe 50 to 60 for response. Yeah, I think it's because we do a lot of those other things too, to augment the response.
Yes. So,
Um,
but it's so important, right?
yeah, yeah, yeah. But
I
at least
like that.
effective as medication, I think is a fine way to say it without the side effects, which is great. I mean, I'll tell you something. This is another, well, just interrupt me if you want to ask your other
You go
question.
ahead.
When I opened TMS, and I was like the first person in Southern California, I'm like, oh, like I don't,
2009, correct?
yeah, 2009. And
Yeah.
so private first person. And I had my private practice going on, and I'd been doing, psychoanalysis, psychotherapy, pharmacology for 10, 15 years.
Mhm.
And, you think your people are good, right? I mean, they're good, like they're better, right? And so I wasn't really offering it to any of my patients, right? And so time goes on, I have the little flyer in my waiting room, and my patients start coming in and they're like, "Well, can I do TMS?" And I'm like, "Well, you're good, right?" And they're like, "Well,
Yeah.
I'm better, but I'm like, I'm not like my real, like I'm not 100% better," which is you lose perspective, right? Like I met
Yeah.
them much better than when I met them, but that to me is the difference of TMS. And then those people went into
Yes.
TMS, and the way you pop, and I don't know how other way to say it, but pop, like the clarity of mind and the feeling, it's just, you have to sort of do it to like,
Yes,
oh, right?
you do. Uh,
It's different better.
yeah, no,
That's the
100%.
better.
I
Yeah.
know. I know.
Yeah.
I know. I was
Yeah.
afraid to do TMS for I looked at TMS for 3 years,
Wow.
had TMS chairs, treating people with TMS be
Kyle.
before I was willing to get in the chair myself. Unfortunate accident happens in my life that left me broken and just a shell of a man, and I knew I couldn't live like that, which
Yeah.
being that I had TMS chairs, thankfully I knew the right people to call to get in a chair.
Awesome.
And
Yeah.
here I am today, just a better man, all around. And like you said, pop, right?
Yeah.
It,
Yeah.
there's no difference. A lot of times I hear people say TMS TMS made me the old me, or I hope TMS will take me back to the me that I was once upon a time. And I'm like,
You don't
you're
want that,
shooting
right?
you're
You
shooting at
want
the
the new
wrong
me,
you're shooting at the wrong goal here. Let's just
new
make
and
you
better
better than you've
version.
ever been. Because that's what
Yeah.
TMS did for me.
No, that's a
You know,
great way to say it. How come you were so fearful of doing it?
it messing with my brain.
Yeah. Yeah. Well, like I say, that's the most common thing I hear. I mean, our brain's an important organ,
And that's
right?
honestly, that is why I talk TMS. That is what started it. And like I said, I was treating people,
Yeah.
not
Yeah.
we were treating people.
Yeah.
And
Yeah.
there was no way I was getting in a chair. There was no way, right? I knew the benefits.
Yeah.
I knew the benefits of it. I watched the benefits of it.
Yeah.
Wasn't going to do it until it was too late that I
Painful.
had no other choice. And that's one of the biggest messages that I want to get out there is don't wait until it's too late, until you have to do it. There's
Absolutely.
no point. Do it now.
Yeah.
You can receive this treatment now,
Yeah,
right?
that is a great message. And yeah, not, I mean, it is scary for patients. Like the best, some of the best ways that I've helped people come in is we let them talk to other patients, right? Because
Right.
I think that helps too, right? Of course, I hope they trust me and they believe me, and or they can read other stuff on the internet.
Uh-huh.
It's just about like our services. Now there's a lot out there, your show. But there's nothing more than sometimes just another patient to say, yeah, like I did it. I was really afraid too, right? And it was
Right.
the best thing that I did. And it really helps them feel comfortable, and feel like, yeah, really cared for versus marketed or, yeah.
So on the depression front, how does TMS help with grief? You mentioned grief earlier, and I kind of wanted to circle back to that.
Sure, sure. I wouldn't say I think TMS would be a treatment specifically for grief in
Right.
itself, right? But grief is very complicated, right? And
Mm-hmm.
so, yeah, when I mentioned grief before, people sometimes don't think of grief in a broad term, or maybe the way I think about grief, which is is
Okay.
is loss, right? Grief is just loss,
Yeah.
right? And so a lot of people think of grief when the loss of a loved one or a loved pet who passed away, right?
Mm-hmm.
But people grieve over loss of jobs. They grieve over loss of relationships without death. They grieve over loss of abilities, right? They have. They grieve over having a medical condition, right?
Yeah.
Um, so I think though that's really more responsive to a therapy, a talk therapy modality.
Okay.
However, when grief ends up not resolving as we expect it to, and leads to a depressive disorder, then TMS is
Mm.
the absolute go-to, right? Or if grief is causing a lot of anxiety because maybe now they are fearful to, maybe get back in the car because they had a big motor accident, and that's what they're grieving, that loss of that feeling of invulnerability, right? And now they're having
Right.
anxiety. Or yeah, they're just, they can't get in another relationship because maybe that person, something very sad befell them, and that relationship is now gone, to nobody's fault, and now they're just depressed and isolated and anxious to even trust to get in another relationship. There, I think TMS can have a really important place for them.
Thank you for that. So, it's funny to me, but one of the questions that we see typed in on the internet all the time is TMS safe with dental implants?
Yeah, no, that's a common question we get too, right? Yeah,
So funny,
very safe.
I have a dental implant, and I treat children with braces. So I understand the
Yeah.
question, and I would like to pose that to you.
TMS is very safe with dental implants. Yes. And it is a common question that we get also. And understandably, right? Because people think about metal, and we always say that. That's how we say it, like any metal in and around your head. And
Right.
immediately go right to their, fillings and dental posts, or, braces, as you mentioned. Um, but no, it's very safe. And there's new studies that came out with safety. So we used to even say, well, we worry with implanted physiological devices, things like that. But really, the only absolute contraindication to TMS is ferromagnetic material in the head or within around the head, like 30-centimeter radius
Hmm.
from the coil. And it's very rare that we have that these days, right? We can have, people that actually have shrapnel from bullets. That would be, something we can't do anything
Okay.
about,
Yeah,
fortunately.
yeah.
Even aneurysm clips now, old aneurysm clips, we can't treat with that, but new ones, it's not a problem. We can even, people can have, I treated a gentleman who had a terrible skateboard accident and a huge skull fracture, and was missing part of his skull and had a plate. And I could treat him. You
Wow.
cannot treat over the plate because it will block the magnetic energy, right? So
Right.
you have to treat on a different side, but he had a great response. You can treat with stents, you can treat with vagus nerve stimulators, right? You can, things like the pacemakers, you
That
have
was
to
my next question. What about pacemakers, right?
yeah. It depends if you can turn them off,
Okay.
right? Or disconnect. So we always talk to the manufacturer, but we've treated people with that. I had one, the manufacturer brought us this big magnet like that. And oh, it's gonna give me a heart attack. Like would put it over his pacemaker, and it would shut it off, right? For the time of
Okay.
yeah, for the time of the TMS. So that's where, yeah,
Okay.
like I'm sweating bullets, right? Because I do
Yeah.
not have a cardiac event during the DMS. And then we take it off. And so like even that, so there are ways you have to check usually with the device manufacturers. Obviously, you get clearance with their cardiologist or their neurologist if they have,
Obviously, right?
like a spinal cord stimulator, right? But really the safety is excellent. Dental implants are not a problem. And the vast majority of even physiological devices or metal stuff in and around, we can work around.
So we've touched on this a little bit, but I want to ask specifically about TMS treating anxiety.
Yeah, very effective in my mind. TMS is very effective for anxiety. There's new FDA clinical indication recently for anxious depression.
Hmm.
It captures that. And I think it's figuring out, like I said, that teeter-totter with depression and anxiety. I think sometimes it's hard to separate out, is this a anxious depression, right? Or is this a
Yeah.
primary anxiety disorder with a secondary depression? And oftentimes we see them both there. And so, we can do a typical left-sided 19-minute protocol. And a lot of people with anxious depression really get better, both their anxiety and their mood. Right. If we have
Hmm.
people that we feel really, really high anxiety, really maybe that's a primary diagnosis, then sometimes we do a right-sided low frequency treatment with also great results. Right. OCD is an anxiety disorder.
Yeah.
Right. And it's FDA indicated for OCD,
Yes,
and
it
we
is.
have great results with OCD. So I would say yes, TMS is great for anxiety, and I would love to have generalized anxiety disorder like on that list of clinical FDA approved indications.
How long till you think you'll see that?
I don't think they'll go that route because, yeah, there's probably not really a need. It's just like with the medications, right? Like they get approved for depression or mood disorders, like
Right.
serotonergic ones, or, and then we know everybody just uses them in anxiety and they know if it works, right?
Right.
So I'm not sure the manufacturers like want to spend, I wish I would get like the time and money for these
Yeah,
huge
yeah, yeah.
trials, right? Like
Mhm.
this is another one, like to me, pregnancy. Oh my goodness.
Ah.
We've treated a lot of people, not, I mean, we treated a fair number. I actually did a little paper on this of TMS for pregnancy. To me, this is one of the ideal options for TMS. Ideal, right? Now, obviously, you have to be careful. There is enough in the literature that shows a safety. We try to get through the first trimester because there are a lot of things that just happen first trimester that we
Of
wouldn't want to
course.
blame on the TMS. But so many women do not want to take a medication during pregnancy. They're depressed. We know just depression during pregnancy,
Severely,
really
severely
bad,
depressed.
severely depressed,
I'm
right?
a
Prenatal
father of
birth.
3. I know.
Ah, there,
I
there you
don't.
go.
Yes.
Yeah. And like I would love to see an FDA indication for that. That's tricky. It's like you say it's like with the kids, unfortunately, or
Mm,
fortunately, right? And our, as protective measures, we can't enroll people in studies. We don't enroll children in studies often, and we don't enroll
right.
pregnant women, right?
Right. Yeah, yeah.
We can't get the actual data we need except for, really trying to do it and people writing about it. So I'm a big push in the society. I started a pregnancy registry and I'm really trying to get that going.
Ooh, I like that. Okay. Is TMS safe while taking antidepressants, anti-anxiety medications, things of that nature? Big
Absolutely.
question, right?
Yeah.
We see this one all the time.
Yeah, it's an important question,
It
and what
is.
to do with people as individuals. And I think all clinicians are a little different with this.
Mm-hmm.
Um, so yes, it's safe. TMS is safe, right, with meds for both mood and anxiety disorders. There is information about like high dose benzos interfering with TMS efficacy.
Yes, yes.
So we don't want people on, 3 milligrams of Klonopin or, 4 milligrams of Xanax. Like you need to
Right.
get this down. But it is safe, with the proper doses and effective. Um, Safe for the antidepressants. There used to be some worry about Wellbutrin, right? Because that is a risk of seizure in and of
Yeah,
itself,
yeah.
right? Um, but I think the issue of the medication choices to me is this is once again I approach a patient very individually. I know some people would say, "Oh, you shouldn't change anything. You start TMS," and I disagree with that because I think you have
Oh,
to know the person. Yeah. Um,
okay. Let's talk about it. I love it.
okay, it's a good one because sometimes people come to me and they're like on 5 or 6 medications, and they've seen doctors that they're not better. They just keep piling on, and they never take off.
More and more, and here's another one, and here's another one. Yep.
So with those people, what I'll say often is we figure out which one most people can tell, like, oh, that one really helped me. I know when I
Mhm.
started that one, and this one, oh God, I don't know what that's doing. And so I say, hey, listen, we'll start TMS. We'll make sure you tolerate it. We'll see that you're getting a response because we typically have a response. We know after the first 10 sessions about what we expect to see on their responsive. And
Right.
and we're like, okay, then let's slowly start tapering off. Because, you know, and I feel very comfortable doing that because I know what to expect from a taper and I know what to expect from the TMS. Sometimes we can do that a little bit before, clean up some stuff before they start.
Okay.
Um, and if somebody's on, I would say the same thing. If somebody's on a medication and they're having a significant side effect, but we don't know how much it's doing, I'll be like, hey, like, or they say I don't want to be on meds at all. Okay, all right, let's get through the TMS. We get through farther, and then let's like maybe the last 5 acute and the taper and in the taper TMS sessions, we'll start tapering your medication
Okay.
and we'll see how you do. And now we do know, right, being on one antidepressant, hopefully without side effects, is good post TMS to maintain the response, right?
Mm-hmm.
However, right, for each individual, we never know. And so I tell these people, listen, TMS worked for you. You can taper off your medications. Let's see how you do. The worst thing that happens is maybe in 3, 4 months, if it's earlier than the 8, you start feeling a little worse. Listen, you can come back for TMS.
Yeah.
We can get you better. And then during this process, we'll start a different antidepressant. And I also will overlap that, right? Because
Hmm.
I can separate out as a clinician TMS side effects, TMS efficacy, where I think they should be getting better from what with medication. And I've also found, I have treated people with TMS specifically for serotonin discontinuation syndrome. It's
Okay.
amazing. It's amazing. And I think because, we're helping their neurons fire and increase those levels, I've had
Uh-huh.
people could not get off an SSRI or like an SNRI because of significant discontinuation. And with TMS, they're able to do it. So
You're
there's
so
another reason I'd
impressive.
say people should come, like if they need to come off, right? It actually can support the discontinuation syndrome.
The big question, right? Everybody's concerned. A lot of the people I talk to in person, but when you read online, does TMS cause seizures?
Yeah. TMS does not cause seizures, right? There is a very, very, very low risk of a seizure, right? Or I should say it doesn't cause epilepsy, which what people I think confuse.
There you go.
There can be a risk of seizure, which is very low, right? The risk of seizure is lower than for medications. Um,
Mm.
it's lower than, Game Boy. If you look at a Game Boy insert, it's like one in I think 4,000, right? Because of like some of the lights, they warn you that.
Yeah,
And
yeah, yeah.
that's seizures
They
and
have the warning
blackouts.
on there these
Yeah, there's
days.
a warning. That's worse than TMS. So, yes, there's a very, very low risk. And I think early on there were more, there were a few more seizures. And when you looked into it, it had more often to do with two factors: wrong placement of the coil, right?
Yes.
Devices weren't so great in the beginning at assisting, right, proper placement. You had
Okay.
to manually move. Now a lot of the devices, it's sort of built in that like that happens.
Uh-huh.
And there's like things where it won't start. There's better backup systems. And so sometimes, people would find the motor threshold and then not move the device where it should be treated. And if they're treating over the motor threshold, there'd be a seizure. And then I think the other time that we do see it often is there really is a biological reason. So the person maybe abruptly stopped more heavy alcohol use than they had been honest about.
Yeah. Yeah, yeah,
And
yeah.
right, just
Guilty.
yeah. Um, or, when there is one, like there's a group of people that we're very cautious with and we're very clear that we'd rather them not come in if it happens. But, when we treat like overnight medical staff, people that can do shifts and
Oh,
stay up, yeah. So they stay up all night, they have coffee all night,
all
go to
night.
a
Yeah.
nap, 2 things we know lower seizure risk, and then they wanna come right to TMS. And I'm like, "Uh-uh. You gotta
Yeah.
go to bed and you gotta come before your shift," right? Or especially if you do it, sometimes you get stuck. You know what it's like. You get stuck in the ER, and
Uh-huh.
you're doing an extra shift and then you come for your TMS. So those people, I'm very careful to say, listen, like obviously no charge. Like we don't want you to come if you haven't slept and you've drinking a lot of caffeine.
Yeah.
But risk of seizure alone with properly, done right, is incredibly low. And like I said before, I mean, this isn't a great thing to say maybe to patients, but worst thing, yeah, you're in a really safe place when you have a seizure, right? It's having a seizure, right, is like the risk of that is you're driving a car, you fall down and hit your head, right?
I think you're so comfortable with it because the amount of people that you've treated and you haven't had one there. But
Yeah.
when you talk about it, you're so comfortable with it. It's insane. You're like, yeah, yeah, no, you're in a safe place. And I'm assuming that it's because it's never happened, right?
Well, you're right. I might say
Yeah.
differently, like, don't jinx me.
I don't want to, but I'm like, when you talk about it, I'm amazed, right? You're like, no, no big deal.
Well,
But
and I do think
I
that's
understand.
that's also a misconception of like, when do we want people to have seizure? No, but it's not good for their brain. However, like we need to remember what ECT is, right?
Yeah, there you go.
ECT is an induced seizure,
Uh-huh.
right? So, so I think people forget. Yeah, I think I am more relaxed because what we care about the most with seizure is you do not want to be driving a car or hit
Yeah.
your head. Like a seizure itself is not really that bad. You're in a safe place, you're supported, right? Like, it's okay. Then we got to figure out what happened, right?
Right.
But it's, I can think of a lot worse, I guess. Like I said, my biggest fear is somebody has a heart attack or a stroke, like in my sight, right? Not like a seizure on handle.
I got this. No big deal. This is one of my favorite questions to ask doctors. Okay. I have been touched by this topic personally. Um, can TMS treat autism?
Oh, I say absolutely yes. Now, people need to
Oh,
understand it is not FDA cleared for autistic spectrum disorder.
right.
Um, we haven't talked about this, but in addition to the regular TMS, I guess you could call it that. I do MERT, magnetic resonance therapy, and I don't know if you know
Okay.
a lot about that. So the EEG guided TMS.
Uh-huh.
And I have found it amazing for people on the spectrum, as well as other things. So the way MERT works, or ETMS,
There you
is
go.
it's you do an EEG of the brain before you
Hmm.
start, and rather
Hmm.
than, like, we have a set fixed protocol that we use for OCD, depression,
Uh-huh.
anxiety, right?
Uh-huh.
Cessation. Like, this protocol is actually driven by their brain. So it goes off to a lab, right? We're using the same FDA cleared device that we use for the regular TMS, same device, but where we treat and the Pulse protocol is based on their brain. So we think, even though we don't think of it as diagnostically driven, there are specific diagnoses. And when you hear them, they're more whole brain issues. So things
Okay.
like, right, autism, things like uh, cognitive decline, PTSD,
Yeah.
right? Those
Oh,
are, we also do really well with tinnitus, and we do well with TBI.
yeah.
Um, but when you're treating PTSD, autism, right, like the cognitive dementias, right, to me, that's the way to go. And that is TMS technology. Um, I think we just need more research. They are doing some big research trials now at a couple sites for the EEG guided TMS for PTSD. I think that is going to be an indication that comes soon.
Mm-hmm. Now with that, are you treating different locations?
Right now we only have the MERT system in Manhattan Beach.
Okay.
And when we, and I'm not a child molesting psychiatrist, so it's hard. We've treated some very, that you can treat down to the age of 3, right? When we're treating, I've
Uh-huh.
treated, the
I've
youngest
seen it.
is 6. Yeah.
I've seen
And
a 4-year-old treated,
okay.
and it was
How
amazing.
how they
Best
do?
thing, best thing I've ever seen. The reason why this is my favorite question,
Right.
um, I've seen it happen.
Yeah, me too.
And not only that, it's I'll try and keep it short because it's a long story,
Oh,
but my nephew
okay.
was treated for autism by the same doctor that treated me, and
Okay.
I didn't know it at the time. But when I went through my treatment, he had already treated my nephew.
Oh, wow.
And I I had kicked that doctor out of my office because he said that he could treat autism, and the same reasons why I wasn't going to get in the chair, right? I kicked the man out of my office because he told me he could treat autism, and little did I know, at that time he had already treated my nephew and
Wow.
helped him out so much. It's
Yeah.
not even funny.
Yeah. No, it's incredible. So the hardest thing with the children is the parents need to help them practice, like, for the
Yeah.
EEG. We can do like a day pro model versus the heavier EEG, and it's a little,
Mm-hmm.
make it a little bit easier, but that is some work, right? And then, with those children, when change is hard, and movement's hard, and so it's a big commitment to get them into the office every day.
Yeah.
They do not have to sit in the chair, which is the cool thing. Like, they can play
Yes.
around.
Yes.
They have
Yes.
toys, right? We have a little bell that goes off, and then they can come, and we hold the coil, and we count down for them. And they actually
Uh,
quite well over time. But I have seen kids who weren't sleeping. Their parents had not had like a night to sleep through in 8 years,
yes.
and then
Yes.
you start sleeping,
The
right?
families, the benefits to the families, the whole situation to me is
Yeah,
the most beautiful thing I've ever seen or been a part of, right?
yeah,
So special. You're helping the entire family
Absolutely.
And it's such a beautiful experience to be a part of, right?
Yeah, yeah. No, it's incredible. And those are the main things. The sleep gets better, their social reciprocity definitely gets better. And we've had people that have lost speech, had speech as children, that lost it around 3, 4, and
Uh-huh.
regain speech with
Uh-huh.
or it's incredible. Now they do need to come, it's a little like we sort of the routine is you really try to pick, like, I mean, every summer they're coming for a stint of time,
Yeah.
maybe 4 weeks, because obviously they're developing and growing and you need to keep
Hmm.
going. And so you want the families to understand that expectation. It's not a one and done, right?
No, yeah.
Um, but it's
Super important on that too.
really incredible. Yeah. Yeah. Was astounded with the outcomes.
Thank you for all of that.
You are welcome.
I've asked several doctors that question on camera, and you just blew that one out of the water. I really appreciate that. And I love how you personally lit up while answering it, which
Yeah.
goes just to show the human in you, right?
Oh, thank you.
Which again, not to discredit all the other doctors that I've talked to, but it's so special to see. It
Oh,
really is very special to see, and I thank you from
yeah.
the bottom of my heart. I
Oh,
mean, you already know what you're doing for people's lives, but it's so nice to hear it. And just the
feel
care that you have for it.
so lucky. Yeah. Like, I mean, I feel so lucky every day with what I get to do. I mean, the way
Right?
it's crazy, right? I am so honored. People like let me in their lives and they
Yes.
like trust me and I really have an impact. And I'm like, I can't imagine doing anything else. And once again, I know so many people have jobs, right, that they go to every day.
Mhm.
It's like, I'm just, like, so happy with what I do every day. Like, it's crazy to me. I mean, right, there's things about the job you don't like, but I mean, overall, like, I'm just yeah, it's so
I
meaningful to me.
I find myself sometimes being asked, how was work today? And I'm like, you know what? I worked my butt off today.
Yeah.
And as it's coming out of my mouth, I have to stop myself because I'm like, no, I didn't. No, I didn't.
Yeah,
Did I really work? It's not like I was up on a roof, you know.
right.
I wasn't digging a ditch, you
Yeah,
know. I
yeah,
wasn't, and so I laugh about that from time to time. I really do.
I know, I know.
Can TMS help with bipolar?
Yes, right? Once again,
Hmm.
we treat a lot of people with bipolar disorder. It's not FDA indicated for that, so insurance will not cover it currently for bipolar.
Right?
They absolutely need to be on a mood stabilizer, right?
Yes,
So
yes.
in general bipolar disorder, we don't like to leave them on chronic antidepressants. The problem is, people with bipolar disorder spend more time of their life depressed than certainly hypomanic, right? And so we put them on an antidepressant, maybe they do okay, they start cycling up, we take them off the antidepressant, they get depressed, and we know that long-term antidepressants really just are not good for long-term, rapid cycling or cycling in general.
Hmm.
To me, TMS is an ideal treatment for bipolar. It should have been one of the indications, right? With the requirement that the person be on a mood stabilizer. It's a powerful antidepressant, right? So while antidepressants
Yes.
can make people manic. So we have really great successes if they're on a mood stabilizer, and they just need to understand the risk. Like keep very close contact. If they start having just a little decreased need for sleep or feeling a little bit irritable, then we can pull back a little bit. We can take a day, break off,
Hmm.
we do
Hmm.
just theta burst rather than doing a whole single pulse protocol. So there's a lot of adjustments that we can do, but really great results.
And the consistent thing with your answers is the individualized care.
Yeah,
Um,
yeah,
and that's something that I hear is when I talk to a lot of people that tell me that they've been, because of the channel, right? I've been affected, I've been harmed by TMS, and the key component every time is you weren't treated as an individual.
right,
You were not. I
right.
mean, I'm not talking bad about that doctor. I don't know that doctor, but what you're telling me, and I'm sorry, I believe you,
Yeah,
sounds like you were just put in a chair and the machine was turned on,
there you go. I
right?
know. Perfect. Because we tell that too. We have people, I tell, the doctors that are work with me and the primary mental health nurse practitioner, it's like, even if a patient says, "Oh, I did TMS, it didn't work for me." Okay, you got to figure out what they really did. Like
Yes.
what protocol they got, where they went, like what was going
Yes.
on, right? Because, was it even placed in the right place? We've had
Right.
people come and be like, oh yeah, my arm was moving like this, like the whole time,
Well,
like,
I've
ooh,
heard that one. Like,
heard that one, right?
what was happening?
Yeah. They
That's
were
not
not
supposed to
treating you in the
happen.
right place. Yeah,
Yes.
yeah,
Yeah.
yeah.
Is TMS treatment safe for kids?
I like to think so. Like I say, I've used it for autism.
Mm-hmm.
Right. I think that it's once again, we don't have the lovely safety data we would absolutely love to have.
Okay.
I first to say though, I had a young child and they needed TMS. I would do that before a medication. Absolutely.
Amen.
So
Amen.
I feel, yeah, enough safety about it that would be my choice as a parent. I think it's tricky. I've treated a lot of at least 16-year-olds. I think that's
Okay.
16, 17. I've treated a lot. We've gotten insurance coverage for a lot of those kids too,
Okay.
which is amazing.
I've seen a lot more of that lately. That going a little bit younger, which is nice.
Great. I think they're moving that way. And like I
Mm-hmm.
said, I've treated the young kids on the spectrum very safely, and I wouldn't do it if I thought there was a problem. But can I with really evidence-based research literature say it's all safe and with the developing brain? I can't. My gut is it is. And like I say, as a parent, I would do TMS over a medication for my child.
Full disclosure, I've treated my child, so
Good for you.
9 years old.
There you go. How they do. Good.
Loved it.
Yep.
Loved it. There's a
I
video
treated
on it. Go
I
check
treat
it
my
out.
daughter too. Older. I mean, not in 20. So I know, you were talking about I do word therapy. I do it like I do the EET, I'm on my preventative health cognitive kick.
Mm-hmm.
Right. Sometimes my staff laughs because like I go in and do it. Sometimes I'll just do it myself, like because I know like you put up a big mirror and they'll cut me off. They're like, Martha, like you're like you're having too many ideas and you're too on it. Like you gotta take a break. We're cutting you off with the
I
mermaid.
love it. I love it. If you've done TMS,
Yeah,
not a
yeah,
girl.
yeah.
Girl, how many
Absolutely.
sessions?
I've done 3 rounds with full.
Okay.
Yeah,
Okay.
yeah, yeah.
I did 100 and my 134th session I did today.
Wow.
My staff counts them for me. What
There you
session is
go.
this?
There you go.
134,
There you
Kyle.
go. Well,
Okay.
you're past me, right? Because 30, I've done
Yeah,
108.
yeah. Uh-huh. Well, so my first round was 40 sessions, right? Um,
Yeah. Interesting. Yeah.
and I mean, I was in bad shape. Kyle
Yeah.
wasn't really the best boy at that time of his life either. So a
Okay.
lot of damage had been done.
Yeah.
So those 40 sessions cleaned me up real nice.
Great.
And then
Yeah.
I ended up buying 2 chairs, or two
Awesome.
different chairs.
Cool. So
So
you
yeah.
do continuation or maintenance.
Maintenance.
That's
Um
what needs to be approved too, right? Like,
uh and so I did a session last week. I did a session today.
okay. Yeah. Yeah.
Um no reason other than I knew I was going to talk to you and I wanted to be my highest performance, you know?
There you go. Yeah.
And I do believe it's in best words I can find right now, it's a performance enhancing drug.
Yes.
And
Yeah.
I do know professional players that use it that way.
Yeah.
Um,
Yeah.
I've treated Hall of Famers here in this office.
Okay.
Um, active, active professional,
Yeah.
right? Athletes. And no, that's I want to see more of that. And they won't let me yet,
Right.
but I'm working on getting them on the channel to humanize this process.
Yeah. It's
Um,
so hard, right? When I think, deal with that population. Yeah, we had I've tried, we're right near like the LA
uh-huh.
for hockey. We're near the new site for the Chargers and the Rams. And I've tried so many times, Kyle, because I worry so much about, chronic traumatic encephalopathy. And I like if these people were
Yes.
thinking right, they would in their off season, everybody would do TMS.
Yes.
Right? Like particularly maybe the MERT, like, and there's just such a block, I think, in terms of wanting to acknowledge any brain injury with the sport. There's just it's just a wall that I keep like I can't get in. So if you get in,
Mhm.
let me know. And the
Well,
interesting thing, I treated a professional football player's son.
okay,
Had to learn it was really for a math disability. He did the MERT, so there's another child. Did great,
okay.
right? Did great with it. And I said to him, "Hey, I'll treat you for free. Like, I just want you to see
Yeah,
what
yeah,
it's, treat you." And then you talk to your
yeah.
buddy, right? Talk
That's
to all
right.
your pro guys.
That's right.
So he says to me, "Okay, like I'm really busy now, like in the new year, right?" This was a couple years back. So sure enough, I follow him up with him and he's like, like he's just too anxious to do it. Right.
Yeah.
Which is really sad. And I get it. I get the culture around that. But it's to me like
I think
professional
that's a big part of
athletes
it, though.
not using this, that is just crazy. This is such a valuable preventative tool for them, as well as peak performance, as you say.
Yeah, yeah. The CTE is a huge one. My best friend committed suicide, and I
Uh,
truly do believe in my heart, knowing the man, I knew him 33 years, that that was a humongous factor of what was going on with him.
yeah,
Um, and you see it all the time. You
yeah,
see it all the time. And if we can help with that, you see the culture, men don't cry and all these things. The 22 veterans a day. That's what I focus on a lot here in my clinic is veterans.
yeah,
Getting these boys and girls into the chair.
yeah,
Watch. Just
yeah,
give me a couple weeks and tell me you don't feel better.
yeah,
Watch,
yeah.
Um, yeah, yeah. So
Yeah, no, that's beautiful. Yeah, we struggle with TRICARE too. We accept TRICARE. It's very hard to get them. They'll come, then we try to go back to their primary, like we can't get them in, right?
they'll call their PCP, get the referral, and they're gone. They're gone.
Yeah.
Um, I live in Temecula, right?
Okay.
I got Camp Pendleton right
Yeah.
down the road.
Yeah.
My little valley here it's a military valley.
Right.
So many active duties, and they want it, and they're like, go to your PCP, and they're like, bye, Kyle.
Yeah, that's right. That's what happens to
Talk
us.
to you later. And I'm like, it's
Yeah.
sad. It's so
I know.
sad.
I know.
Um,
So there's a it's called ETMS Ohio.
okay,
And it's a organization that has established government funding. I think they've done it in Ohio, maybe Michigan, don't quote me. You can do etmsohio.org and they're literally, I've tried to get them to come out to California, but it's all for TMS for veterans. It's the ETMS, right, for PTSD really for veterans. And
okay.
they yeah, they're really, they've made a lot of headway in certain states. So that's promising to me, right?
Wonderful. That's
Yeah.
wonderful. I'm treating a veteran right now. He had done TMS before. He had done standard TMS, and I'm giving him PR TMS,
Okay.
personalized repetitive, right?
Okay.
And he did standard TMS 2 years ago. He did 2 or 3 sessions of PR TMS, and he was just like, Kyle, night and day. I feel amazing. I think it was his third day. He said, this is the first day I don't want to take my life,
Okay. Yeah.
and you're like, shit,
I
come
know.
on.
Say that.
And so him and I are working on a couple things to help
Yeah.
and get
Okay.
more of them in the chair because the 22 a day breaks my heart. My
I know.
grandfather's a Montford Point Marine, right? First Black Marine Corps unit. And
Wow.
it's my passion to help.
Yeah.
Just naturally, I think I'm born that way, but then I have 90 years of military service above me.
Yeah.
Um, and so I really am passionate about helping them so much, but
Yeah.
it's so hard, right? So many hurdles to jump.
I know. I know. But so important, right? To just keep
So
pushing.
important. And we just got to keep jumping them, right?
Yeah.
Keep
Yeah.
jumping them. That's all
Yeah.
we can do.
Yeah.
Okay. Me and you, man, we're gonna be
We
here all
gotta do this again, Kyle.
we're totally gonna do this again.
All right. Awesome.
Um, when I was at the CTMS conference, right? I saw this device, and they were leading on that TMS was going to be being done at home. So my question is it safe for TMS to be done at home?
That's a great question. And I should have included that in the future of where TMS is going, right?
Right.
I do know some scientists that are working on helmets, right,
Mhm.
where they would have the TMS, right, and at home, and so the mobile, right, opportunity,
Yeah,
and I
yeah.
safety has to do with there needs to be, right, assurances that the helmet is on the person's head that we know, which there should be, we should be able to do that, right? We have technology that does Face ID and stuff,
That's
and where
correct.
the coil's placed, right, that the helmet's on correctly, and then what the protocol is. And then I would think they, making sure they can't just turn it on themselves for a certain, there's all those stopgaps. So do I think it could be safe at home? Yes. I think it has to be, we need to ensure it's the right head, the right placement, the right amount of time, the right protocol, and the right oversight with, like, that they, maybe they can't, it won't work if they haven't done their proper follow-up with their clinician to make sure, right, that there's nothing going wrong. If you were at the, so we were at the Colorado Springs?
I was.
Oh,
I
I did
was.
there. So did you see the presentation? Like, so Suzanne Kearns, they're from South Carolina. They were doing motor thresholds in outer space. How about that?
I didn't see that.
Yeah,
I
it's
didn't
awesome.
see that.
Yeah. So their thinking is like, wow, like eventually at some play time, like we're gonna have to be off this planet. We're gonna be somewhere else. And
Okay.
take a whole, like, what are you gonna do? Have pharmaceuticals and all these meds and whatever? So like what better treatment? I know, blown
Oh
away,
my
right?
goodness.
What better
I
treatment
love it.
than TMS? So they wanted to know, like, well, what would happen with somebody's motor threshold? And it's what you see, it lowers on everybody because, without gravity, I think our brain gets closer to our skull. And so they
Okay.
finish, yeah. And so everybody's MT on Earth was less than it was when they were in, zero gravity.
Really?
But it was a very cool study, and they had such little time, right? Because there was only a certain amount of time they could be up there doing it. It was very cool, but we had
Imagine.
pictures, and yeah.
And just be hanging out in space all
Yeah.
the time,
So there you go. So not only could TMS be at home, but TMS could
Uh-huh.
be in outer space eventually.
Well, you just gave me a wonderful idea for a video. Thank you for
All
that.
right. There you go.
What are the requirements for TMS regarding insurance?
Yeah.
Right? How
Yeah.
are people utilizing their insurance to pay for TMS?
Yeah. So I think we've seen a lot of positive movement here in terms of the requirements for authorization go down, which really makes me happy, right? It used to be 21
Mhm.
and up and now it's 18 and up. A lot of places had 4 medication trials plus augmenters. Now a lot of insurances are 2 antidepressants. But bottom line, somebody has to have, meet criteria for a major depressive episode of
Mhm.
certain severity of their PH29. It's a rating scale we use for the depressive episode, and they need to then have failed or tried. So I remind patients, you
Mhm.
don't necessarily have to have taken a full trial medication. If you took it a day and you had a side effect and it wasn't tolerable, that counts, right?
Mhm.
Um, and so, we find coverage, we pretty much can get it covered for everybody. And, most people it's fully covered. If they have a deductible, then that has to be paid before. And a few people have maybe a $20 copay, which can add up, right? Because it's
Yeah.
$100 for the week. That can be hard for people. But we certainly work with people. So I think insurance still needs to continue to improve, but I think it is. I think the insurance companies are wising up about, like, this is actually a cost-effective treatment compared to multiple antidepressant trials. And
Mhm.
they've now extended it, right, like I say, to OCD coverage. So bottom line with me, I'm telling patients, like, I treat them clinically, right? I make a recommendation if it's clinically indicated, and I tell them, this is what your insurance requires, and I need to know what your history is, and we go from there.
Okay. Thank you for that. What does this say somebody doesn't have insurance? What is TMS or let me ask it this way. What
Yeah.
should TMS cost somebody, right?
Yeah. Oh, that's a great question. I would love to, yeah, I would love to say zero. I mean, you'll laugh at
Amen.
me this time. I was doing TMS all by myself, and then I partnered, obviously, because then I was doing the insurance and the back of the
Uh-huh.
expansion, and I was treating a lot of people for free. And then eventually, like, and then there'd be staff, right, at Clear, and they like, oh, well, I'm a little pressed. Oh, come over. And finally,
Yeah,
like, my
yeah,
partner's
yeah.
like, Martha, you cannot keep treating people for free.
Oh,
Like,
oh,
I'm trying to run a business here. Um,
man,
so
you're
yeah,
not wrong.
Ugh, I would love for it to be full, no out-of-pocket cost for anybody, ideally. What we do is it depends on the patient where they are
Mhm.
socioeconomically. And also we have the advantage of like we're like a family system. We have Clear, we have Sober Livings at New Life, and we have, sometimes they say, oh, well, you're a member of the family because you went through Clear, right? So
Okay.
so we
Okay.
can give you a really good rate,
I
right? Because
love it so
it's sort of
much.
like part of the family. But in general, if we would, sometimes we'll charge what we would get from an insurance, which could anywhere from 250 to 350 a session, and sometimes it's free.
Okay.
It's we really want to treat the patient.
Yeah. Bless your heart, man. Bless your heart. Can one continue other forms of therapy
Uh,
while doing TMS?
Absolutely, yes. They can continue other forms of therapy while doing TMS. And as you are laughing, because I would say they absolutely should be continuing other forms, right? It's really
Okay.
like a 1 + 1 = 3, right? Like I am just a strong believer is we are not, we're humans. We're not biological creatures or just computers. And
Mhm.
so we can do a lot with very powerful biological treatments. TMS is an amazing biological intervention. And then we also have to treat the human, right? And
Right.
so people have to have perspective on their life. They have to understand how to communicate, right? They have to understand what triggers are for them, like how they can cope with things, like what things make them happy, right? Um,
Mhm.
and so, yeah, I think we strongly push for people to be in individual therapy if possible, and sometimes there's a specific type. If they're struggling with OCD, then we really like the CBTs and ERPs, and if it's really more them realizing, oh, like I don't even know who I am, I've been depressed for so long, then obviously we want more of a psychodynamic model. I think it's really important to have therapy with TMS.
Are you running those at the same time?
We do not have therapy in-house, so we do not.
Okay.
Yeah, so we do not, do that, but do we encourage people? So a lot of people, I'm in a more privileged environment, I would say, with a lot of the patients that come to us are in individual therapy,
Uh-huh.
and yes, they continue that. Maybe 30, 40, or maybe 50% aren't, and sometimes it's a little too much to add right away. So we do our clinical initiative. We talk because there's a lot of therapy that goes on. We try to match our patients with their tech so they get the same tech every time they come. And there's a real relationship that's built there. And a lot of therapy happens in the room with the TMS technician. Um, but then when they get to their tapers and they're feeling better, their energy's better, their organization's better, their motivation's better, then we get them into therapy to start. So I think when somebody comes in and they're a bit overwhelmed with the whole process, right? And they're
Right.
anxious, we're trying to get them settled in and they don't have a therapist. No, we don't pounce on it right away.
Got
We
you.
sort of get them better and then we help them while they're in that 3-week taper to make sure that they have a warm send off.
A lot of people simply type in, where can I find TMS? Right. And granted, you have 9 in the LA area, correct?
Yeah.
And we're gonna get into that. But what advice would you give somebody that's typing that in, right? To me, it's so much broader
Yeah.
than just that question, right?
Yeah.
Any advice? What would you tell them?
Yeah, it's an important question. Um, Oh, a bunch of things. I think, there does need to be an understanding of how much experience, I think where they're going. I mean, people can do something bad for 10 years. My dad used to say you could do something really bad for 10 years or you could do it right the first year. So it's not always about the length of
Yeah,
time, right?
yeah, yeah,
But
yeah.
but I think, experience counts with this in terms of ability to find the motor threshold to understand. So I think understanding that, I think understanding what device they have, because there are differences in terms of some tolerability and even safety with different devices.
Mhm.
Um, how often, who does the calibrations and recalibrations and how often they see, the medical provider, I think is a really important part of the process. I would worry a little bit about someone going to a site if they're like, well, I just see the primary health nurse practitioner or the doctor, whoever's, prescribing it. And then I just see the tech for 9 weeks, that I don't think is a good model. You want to understand what protocols they have. right?
Yeah.
Do they have just one protocol that they do, or are they able to adjust their protocols based on what outcome is happening?
Hmm.
Um, you want to know, how fast they get their authorizations for you, and how fast you get in for an appointment. I mean, it's important. We're talking about like getting a treatment in, right?
Yeah. Yeah. No, you're definitely right on that.
Big ones, right? What else would I say? I think I mean, well, I mean, then there's the practical matter, right? I mean, this is a big commitment. And so, what's the hours that the office is open, and can you park and go right in, and what's the geographic proximity, right? It's a little
Mhm.
bit unreasonable to expect somebody to drive 2 hours, one way for TMS and pay $50 for parking, let's just say, right? Like,
Uh-huh.
so
Yeah.
practicality in terms of accessibility.
I
Yeah, would
drove
you,
an hour and a half one direction.
wow.
And as I told you already, my office is 15 minutes from my house. But I still drove an hour and a half one way to get my TMS. Um,
That you went to somebody you really trusted, you knew, and
and he made some wild claims in my office and ended up getting kicked out. And I was like, put up or shut up. So that, that's how that all worked out. But I love that man so much. It's not even funny. Do me a favor, Doc. Do me a favor. Tell my viewers where they can find you and all the wonderful things that you do. I am going to put descriptions or put information in the description of this video, but do me a
okay,
favor and tell
perfect.
everybody what's going on.
Very simple. They can just look up neurowellnessspa.com. So NEUROWELLNESS and then SPA.com will come right up. Clear Behavioral Health, also great resource. So if they need beyond TMS, but maybe a little bit more higher level of care, Clear Behavioral Health, they can also just type that in. It will Google right up, and we would love to make their lives better.
And I appreciate that, Doc. And I appreciate you. I appreciate you. I appreciate everything that you do. As I said in the beginning, you're a pioneer, but you're such an inspiring and amazing woman. This has been an honor for me.
Thank you.
So
Well,
thank you.
honor is mutual. I love your transparency, right? I love your focus. I think our hearts are very aligned in terms of access, education, right? TMS is an amazing, amazing opportunity for people. We know mental illness is a huge problem, right, across the
Mhm.
world, in the United States right now. And yeah, the more people we can have hear about it, know about it, be educated, know that it's safe, right? Know that it's
Yeah.
safe for our brains. I think we'll just be really proud of the work we've done here on Earth.
Hey guys, I know you liked that video. Do yourself a favor. Click on this one right here. More content about TMS, the benefits of TMS, and how we're going to change the world with TMS. Did you click on it? Click on that one right there.